Hi, my relatives. My name is Dr. Marcia Anderson. I'm a public health doctor. I work with the Winnipeg Regional Health Authority, the University of Manitoba, and with the Assembly of Manitoba Chiefs on First Nations pandemic preparedness. Last week, I did a video with Grand Chief Arlen Dubas to provide you some public health information, but unfortunately the sound quality wasn't great. So I did want to provide some more videos with some of that information today and in the coming days. So today it is Tuesday, March 31st. Currently, we have 103 cases of COVID-19 reported in Manitoba, occurring in every regional health authority. As of tomorrow, non-essential businesses are ordered to close, and as of yesterday, by public health order, gatherings have been limited to 10 people. These are all actions that are being taken in support of social distancing or physical distancing, and that's the topic that I want to cover today. What is social distancing or physical distancing, and why do we have to do it? So when we talk about social distancing or physical distancing, what we're talking about is staying 2 meters away from other people, or about 6 feet, or about 2 arms lengths. The reason that we want to do that is that the virus that causes COVID-19 is spread primarily by 2 ways. When people who are carrying the virus cough or sneeze, it can travel for up to about 2 meters. So if we stay 2 meters apart, we're less likely to spread that virus to somebody else if we're the ones carrying it, or to get that virus if someone else is carrying it and coughs or sneezes when we're around. The other way that it can spread is when someone who's carrying the virus has the virus on their hands because they've coughed or sneezed or touched their face. They touch something, then we touch it, and then we touch our faces. Okay. Now, at this point in time, what we're really asking everybody to do is to stay home unless you're an essential service provider or you are out getting essential supplies for you and your loved ones. So if you are going out, say to the grocery store or for a walk, you still want to be following those social distancing measures. You still want to be staying 2 meters apart, or 6 feet, or 2 arms lengths. And you do want to be washing your hands frequently, either with soap and water or with hand sanitizer. Now, some things you might be wondering are, can I go outside and hang out with my friends? And the answer is not really. In fact, it's no. You really should be staying close to home and spending your time mainly with those in your household. It is okay to go outside for a walk or a run or a bike ride, but we want to make sure we're still following those public health orders about keeping our gathering size to less than 10, and we want to make sure that we are staying physically farther apart. Now, the reason we need to do this is because we are seeing rising number of cases in Manitoba and across Canada. By staying farther apart, what we do is we slow the spread of this virus. I am going to post a picture in the comments that shows what a difference it can make if we are following these social distancing recommendations, if we are staying at home, except if we're essential service providers or getting essential services. So let's say we are carrying the virus and we don't follow any of these measures. By 30 days, we can be infecting up to 406 other people. If we reduce our social exposures, if we follow these social distancing mechanisms by 50 or 75%, then we'll only spread the virus to 15 other people. So when you think about it, even if you're thinking that you yourself are not at high risk of having a severe outcome from COVID-19, think about the 15 or the 400 people you might be infecting if you're not doing this. Think about your loved ones who are older, who maybe have other underlying health conditions like diabetes or lung disease, who might be at more high risk. Think about the capacity, the ability of the nursing station where you live, or the health center, or the hospital, or the regional health authority to take care of you or your relatives if they get sick. And really, let's all do our part. Let's stay home as much as possible. Let's connect virtually by things like Facebook, Snapchat, Messenger, whatever mechanisms that you like to use, and let's do our parts to protect ourselves, our loved ones, and our community.